Welcome, everyone. This is DJ Thatcher, your host for the HealthLinks Podcast, presented by the HealthLinks family of services. Our mission is to engage in conversations related to the medical and health landscape of South Carolina so that we're all better informed. And one programming note, as we begin our third season, we are now offering this podcast as a video cast. So you can watch this as well as listening on your favorite medium. Well, to start our third season of the HealthLinks Podcast, we've got both a topic and a guest that affects all of us here in South Carolina. And we welcome to the podcast Dr. Brannon Traxler, an MD, also with a master's in public health, who is a director of public health for the South Carolina Department of Health and Environmental Control, or DHEC. That's a mouthful. Dr. Traxler, welcome to the HealthLinks Podcast.
It is. Thank you. I'm honored to be here.
Now, the whole topic of public health and all those ramifications, we could talk a lot about. But, one of the great things about our podcast, of course, is the guests. They're all very fascinating, including yourself. You've got a tremendous bio. Hey, tell us a bit about yourself and how you ended up as the director of public health for DHEC.
I definitely did not take a traditional, straightforward path into this role that a lot of my counterparts probably in other states may have done. But I am a native South Carolinian, so this is where I was born, raised, did all but 1 year of school and training, and so I've lived here all but 1 year of my life. And so it is a place that is very special to me. The people are very special to me. I don't intend to leave South Carolina. I can tell you that during my lifetime. There is something about this place that just gets in your system and in your blood, and you love it.
Sure.
So born and raised in Greenville, still live in Greenville, spend a lot of time on the interstate between Greenville and Columbia and other parts of the state too, going to some of our other clinics and sites. But I went to Clemson University for my undergraduate degree in microbiology, and then went straight on into medical school at the University of South Carolina in Columbia, which was the only USC med school at that time. So finished there and then matched into a general surgery residency at what was then Greenville Health System, now Prisma Health upstate. And so did 5 years of general surgery residency, then did my 1 year away from South Carolina, went down 85 a couple hours to Atlanta, and did a breast surgery fellowship through Emory University. It was split between Emory and Grady hospitals in Atlanta. And came back to the upstate of South Carolina, was in private practice there for a couple of years as a surgeon, and really just did not feel like I was fulfilling my mission.
Wow.
Really wanted to do more, have more of an impact. I had spent certainly a lot of years training and studying, and while surgeons can absolutely, make a huge difference and are critically important in our lives, I wanted to do something besides taking out gallbladders and such, and really wanted to look at population health. And I'd been interested in public health some, even early in residency, but had done a project, my research project in fellowship had been involving the Georgia Department of Public Health. And so that was really, that kind of got me on the bug for public health. And so took a leap of faith and left surgery and went back to school and got my master's in public health from George Washington University. So graduated with that exactly 10 years after I graduated my medical degree.
Wow.
Yes, it is harder to pull all-nighters writing papers 10 years older in your life. But they had then, right as I finished it, started working with DHEC as a medical consultant, a physician consultant in our division of acute disease epidemiology. So the area in Columbia that helps oversee with the state outbreak and communicable disease control, and was also the medical consultant for our public health preparedness, the emergency preparedness group. And so when COVID came along, was one of the early ones in the agency working because of my location in the agency, one of the early ones working on this novel virus and what initially was just guidance, and I thought was going to be traveler monitoring and such, similar to what the agency had done during the Ebola outbreak in West Africa several years earlier. And became then, when DHEC stood up its incident command system, its emergency response team for the pandemic, stepped into the chief medical officer role for the response.
Wow.
So served as it.
Right into the fire, huh? That's
it. I do think my background as a surgeon helped me in that.
Yes.
And in terms of the emergency, I also had been an EMT in college and all. And so, there is something, whether you want to call folks adrenaline junkies or what, there is something about folks that like emergencies. I like when they end, but I don't. I
Right.
Certainly, if one's going to be happening, I want to be involved in the response to it.
Wow.
So then stepped into the interim public health director role when the agency had a sudden vacancy on September 11th, 2020.
I saw that. Yeah,
I can remember.
2020, right? Yeah.
And 6 months later, then applied and got the permanent position. Wow. So have been in it a little over 3 years. 3 years. Wow. 2 years now.
2 years. 2 years. Yeah, 2 years. Probably seems like 3. I mean, oh my gosh, what a time to come into both, leading the response to COVID-19 and then taking over the public health agency. So, hey, one big question about your bio that got to ask this. So you're both a Clemson and a USC graduate. So, okay, which way do you go with football? I mean, I guess we got to get that out there.
So, I will cheer certainly for any South Carolina team.
That's a great answer. There you go.
But if they are going head to head, I mean, it's your loyalty lies with your undergraduate degrry, and my blood runs orange. So
there you go.
Okay. I know that a Tiger even when they were horrible.
Oh, I got you. I know people out there who are probably thinking that when they hear your bios. So terrific. And you're also a recipient of the 20 Under 40 award ceremony, right? That's quite the honor too. What led to that?
It was a huge honor. It was our agency director, Director Simmer, nominated me, and understand a couple of partners, both the internal and external of the agency, did letters of support for it. And so it was with the state newspaper. And yes, it was a tremendous honor to receive that. But
congratulations!
Quite a change. I mean, from walking away several years earlier, I joke I'm a reformed surgeon. I mean, it really was a leap of faith. I didn't have a job lined up or anything in public health when I did that, but obviously it was the right decision.
Well, thank you so much for sharing a bit about your background personally, and obviously very well qualified for what you're doing. So maybe a big question in our listeners' minds is, what exactly does the public health division of DHEC really do?
Sure. And so our main goal is really to protect and promote the health of all South Carolinians. And so I tell people that we are doing that and have been doing that for decades behind the scenes. There's a lot going on that is helping to keep people healthy that they're not aware about, that DHEC and our partners are doing. But then there's other parts of it that we do want them to know that we do and have services available for. I joke with people, it's not good if you're seeing your public health director on TV a lot, that, it's usually not when things are going well with health. It's usually not, you're not seeing that person, but, right. South Carolina has some challenges related to the health of its people. And again, it goes back to loving, the state and the people in it. And I really want to see us show the country what we are capable of, and allow everybody to have a better quality of life and length of life.
Sure. Now, you ever see a large team? It's about 2,000 people involved and about 75 sites. I mean, each county has their own office and so forth. What would the average person come in contact with the public health for? Why are they coming in other words?
Sure. And so that's correct. It's all of the we're what they call a centralized public health system in South Carolina. So all of the county health departments are run by DHEC. They're DHEC employees and such. So people will go into the county health departments for everything from needing a birth certificate or a death certificate. Our vital statistics, vital records offices do those, to needing immunizations, a lot of times for school. not just COVID-19 immunizations as people think, but that's where certainly a lot of the talk has been recently.
Right.
But a lot of just the basic childhood immunizations that keep things away, like measles and other really contagious and dangerous outbreaks. To things like family planning, we offer a wide variety of contraceptive services, ranging from birth control pills to IUDs, et cetera. To then we do STD, sexually transmitted infection testing and treatment, as well as a lot of services that are maybe less client or patient oriented, but are still going on. We do surveillance for all the communicable diseases. So if there is an outbreak of something contagious, we've had a lot of RSV outbreaks earlier this fall, and especially child cares. And so those get reported to us, and our team, our epidemiologists, help work with the child care facility to make sure that they're stopping the spread, that they know what steps to take, to improve things. In regards to that, though, sometimes these viruses are just things that we have to fight. It's not something necessarily the place did. Mm-hmm. We do quite a variety of other work. Child safety, we're involved with the governor's opioid emergency response team against the opioid epidemic. We have groups doing everything for that, from statistics and surveillance of it through, we have a couple of first responder programs that we run for law enforcement officers and for fire department firefighters, where if one of those two non-medical first responders is first on the scene of an overdose, they are trained and have that we've given them Narcan that they can administer to the person to save their life. And so those are our Leon and Roll programs, and those have been very successful, and we're continuing to add law enforcement and fire department agencies across the state.
Wow.
So we really do quite a variety of things.
It sounds overwhelming. Sure. Hey, one neat thing too is that the public health department here is nationally accredited, and that's kind of a big deal, isn't it?
It is. It is. We are very excited about that. It was years really in development and in the making, and we got our accreditation in the middle of the pandemic, which again required a lot of folks on the team to put in a lot of hard work and be very flexible and adaptable to suddenly having virtual site visits, et cetera. But we got accredited by the Public Health Accreditation Board in February of 2021.
Yeah, I saw that there's something like 3,000 different levels of public health agencies throughout the country, from state to local, municipality, tribal, and so forth. It's only like a couple hundred that are nationally accredited. So that's a big deal. Congratulations on that. So. Thank
you. Definitely. It was the credit goes to the team who put it, who worked to do it, and partners too.
Okay. So you've got a tremendous agency there, great team, great credentials yourself, nationally accredited, and yet we've got some big challenges here in South Carolina, don't we, when it comes to public health? What's top of mind? I'm sure people are asking you that on a regular basis, but what's top of mind as far as the problems we face?
Certainly. So I think at the moment, some of the biggest problems that we face are, as we mentioned, the opioid epidemic. I think mental and behavioral health certainly have a public health component to them, especially when we're seeing the crises and the levels of the volume of folks with mental health or behavioral health concerns right now. And another big piece is the disparities, looking at places where we may be making some improvement in overall statistics. You can look at maternal or infant mortality, for example, and we are not going to be ranked high in compared to other states in the country. But overall, that number is improving. We are making improvements. However, when you look at it based on race or ethnicity, the disparities are widening, even as the overall rates are improving. And so that's not acceptable to us. And we want to make sure, again, that all South Carolinians have an opportunity to achieve their best health.
Yeah, we see a lot in the news about medical equity and terms such as that. The reality here in South Carolina, though, as you said, there is this big disparity. And what's a root cause of that? If you're looking at why there is this wide array of health services available. Yeah.
And so I think it is very multifactorial. And I think that it has taken years, decades, even centuries to get us to where we are at this point in time. And so I caution people that it's not going to be an overnight fix. It's not going to be resolved in the next 1 to 2 years, but that we are committed. I am committed. Our team is committed. Our agency is committed to the long-term effects and really improving things and getting to a more equitable place. But really, again, it's wanting to make sure that when we're offering services that they're available to everyone, and so forth. But it's not going to be overnight. There's not one simple thing that we can fix that caused it.
Sure. Yeah, those of us who live in the metro areas of South Carolina are blessed with tremendous, healthcare services. And yet, as we get into some of the more rural areas, not that there aren't tremendous people there, just maybe not enough. So what's the effect of, we have a doctor shortage, a nurse shortage, a paramedic shortage? What's being done to address any of that at the state level, if anything?
Sure. And so absolutely. And definitely our rural makeup, and having a large areas that are very rural in South Carolina certainly is one of those contributing factors to why we have the health disparities. And you're right, as we have shortages of the healthcare personnel, they do tend to then, the ones that are still out there working do tend to be in the more metro areas. It tends to be the rural areas that suffer the most from these shortages. And so there is a lot of work being done. We went into the COVID-19 pandemic overall as a nation with a nursing shortage going on.
Right.
It wasn't talked about that much outside of, the healthcare field. I don't think many folks were aware of it, but it has been exacerbated so much by the pandemic that we're really now at a critical point. My understanding is from the statistics, probably the most accurate one is that the country was 100,000 nurses short of what we needed in early 2020, and it's only significantly worse now. We are working with a wide variety of partners, with DHEC to address not just the immediate nursing shortage, but really the workforce development. So we have grants that are doing things like, even with our own staff, doing some tuition reimbursement for staff who want to go back and get nursing degrees. We're working with a lot of the institutes of higher education, the technical schools and the universities in the state to work on building pipelines, not that go, send the nurses all to DHEC, but that send them somewhere in South Carolina to work, and really to make sure we're very purposeful too about filling the gaps in the rural areas also.
Sure. Yeah. We talk a lot about COVID-19. I know one of the challenges that we have here in South Carolina is just our immunization rate with everything, not just COVID-19, but I guess it's all immunizations. Is that correct?
That is correct. That overall, South Carolina has not historically been a very low vaccination rate state. South Carolina has been generally, I'd say, pretty average, or at least not far below average when it comes to vaccines. We have had a lower uptake rate for the COVID-19 vaccines, and I would say the data is still coming through to see what effect all that is having on routine childhood immunizations. But I do think that we are seeing a pretty significant impact from that, that spillover effect into childhood immunizations. And that is concerning. That's an area certainly that we're focused on because, putting aside even the COVID-19 vaccine, these childhood immunizations are so critical, not only for our kids to stay in school and be healthy, but for really our society to keep functioning. And so we've got to keep things like polio and measles and whooping cough, away. And the way to do that is through these vaccines.
We're seeing a comeback of some of these diseases that we thought were just eradicated, like measles, right? Or what else are we seeing a comeback? Maybe not here in South Carolina, but certainly here in the States, we're seeing it.
Certainly. And, there is currently ongoing right now a large outbreak of measles in Ohio that I think is something that every health official across the country gets nervous when they are reading about, because it really could be any state. because rates are, not what we need nationally. Measles, you're going to have, out of 1,000 people that develop measles, you're going to have a handful that are going to get brain swelling and potentially brain damage, and you're going to have one or two that die. So it's not a benign disease.
Sure.
It's a very, very effective vaccine, but it's very, very contagious. I mean, much more so even than COVID-19. And so, South Carolina did in 2018 have its first measles cases in, I think it was 21 years. It had 6 cases. Thankfully, it was, stopped there. But we want to make sure that children are still getting immunized so that we don't see another outbreak and end up, in high double digits like Ohio is currently.
How frustrating is it for you to witness just the whole seemingly politicalization of immunizations? Can't even say that. Politics has entered medicine, hasn't it? And it's affected a lot.
With the pandemic, politics did enter medicine, and public health, and I just keep my focus on the medical and public health piece of it.
Right.
There is so much work to be done, and so that's where my area of expertise lies. It's not in legal or political realms, and so I just continue to follow the science and data, and that's what DHEC does. Because we're not trying to be a political agency. We want to just speak the truth to the data and science, and recognizing that there are for some other entities and groups, I mean, a variety of factors that have to go into decisions, but we're gonna leave politics out of it and stick to the truth and science and providing decision makers with the information they need.
I know a lot of people are, maybe it's front and center now in their mind, the whole concept of immunizations, parents in particular, when they're looking at the vast number of immunizations that are required or recommended now for kids. And I think they're questioning a lot. How many is it now roughly that the average child gets as far as immunizations throughout their
and I do not know a total because so many of them have multiple doses. To really protect you, because you may be protected from that first dose that you get, let's say when you're a year old, like for measles, the measles, mumps, and rubella shot. You get that first one between 12 and 15 months is recommended. But that, because your immune system is so immature still, as a toddler, I like to think of it that, toddlers can be very immature. I have one of my own, so I experience the challenges. The immune system's the same way. And so we can't expect off that one dose you to have lifelong immunity. That's why children then, around the age of 4 or 5 have to get that second dose. Sure. And by then their body can make antibodies that will be present for the rest of their life. So there are multiple doses. Thankfully, the vaccine manufacturers and scientists have determined which ones can safely be given together, not only in the same appointment, but sometimes, a lot of times, even in the same shot. There's one routine childhood shot that includes 5 different components now. So that's certainly helpful. Sure. Again, as someone who has my child getting shots and sees her tears, the less shots, the less needles, the better. So
right.
Thankfully, as the number of diseases that we can prevent with vaccines, and therefore the number of recommended shots goes up, they're also simultaneously being able to combine them.
Terrific. All right. Let's shift our focus now away from COVID and immunizations and so forth. How about some of the leading causes of death that we have here in South Carolina? I think cancer ranks up top. Is that correct?
It does. I mean, so at this point, then, when you're looking at our leading causes of death in South Carolina, you're really looking at cancer and chronic diseases. You're looking at things like, heart disease, cardiovascular disease, which often is at least impacted by, if not caused by, hypertension, high blood pressure. Another common disease that we encounter in South Carolina that directly or indirectly leads to a lot of death is diabetes. And so these are chronic diseases that we really are working to decrease the rates of, because they are leading causes of death, and they impact quality of life even of those living. We know that diabetes, is associated with kidney disease and therefore need for dialysis, for vascular disease and leg amputations. It's even surviving with it is not necessarily the quality of life we want for everyone.
Right. Hmm. Something else too that struck me is that the rate of traumatic injuries or deaths from injuries has kind of crept up. I think it's in the number 3 spot now. It's overtaken strokes by a little bit. What's going on with that? Anything in particular? Is it drunk driving or anything that we can put our finger on?
It is not one type of traumatic. I can tell you that. There is data nationally that to show that for children and adolescents, one of the leading causes of death now is firearm injuries. But I don't think we can say that overall, like for South Carolina, for adults, children, for all ages, all comers. As you point out, traumatic injuries have a lot of different etiologies. It's everything from a car accident, which are very familiar, or very frequent, but which have different causes in and of themselves. There could be drunk driving, there could be not wearing a seatbelt combined. I did for a number of years trauma surgery. I mean, as part of residency and training and such,
Sure.
and can tell you that the most frequent patient that we got in the trauma bay was from a motor vehicle collision, and a lot of times the worst off ones were the ones not wearing a seatbelt, or were riding a motorcycle without a helmet. And especially when you add alcohol and high rates of speed into those, and they can have very catastrophic effects. We also, unfortunately, see some of the less frequent, even, drownings, children or adults that don't know how to swim, especially
Sure.
in the summertime. We're on the coast and it is hot in South Carolina in the summer. People want to be near the either natural bodies of water or pools. And so that can certainly be a danger.
So there's so much that you and the entire agency impacts. I mean, how do you decide what the priorities are internally? You've got a limited budget, limited resources to some extent. How do you triage, as they say, what to focus on?
And that's exactly the approach I take, is that we're triaging because they all are important. It's just that some are more urgently important or more impactful. And so we do it a lot in combination with our partners and communities. So all of the communities in the state, we help participate in their community health assessments. And we do a statewide health assessment, looking at the data and outcomes for health in the state. The last one was published in 2018, and we are in the process of the 2023 version right now. It'll be coming out later this year for the state health assessment. And then it'll be followed in early 2024 by the State Health Improvement Plan. Again, the last one of those was in 2018. These are done about every 5 years. And so it's taking those data and outcomes from the assessment and jointly with our partners, with people who represent all aspects of the medical and public health field across the state, saying, okay, what are the needs in the communities? What of these needs to be addressed? And really coming up with that state health improvement plan. And then, similarly, internally, we certainly do strategic planning. The agency has recently published its bridge strategic plan for the next couple of years, but we're working on our public health priorities then within that, will be coming out later this year. But those will align with the state health improvement plan. We're not countering the statewide effort.
Mm-hmm. In an ideal world, if budget were not an issue, if you could wave a magic wand, what's maybe 1 or 2 things that you would love to be able to do in your role as a director?
So staff recruitment and retention is certainly one. As we talked about, there's shortages in all different medical fields right now, and we are not immune to those. A lot of public health workforce took a hit from the pandemic, either just similar to other medical roles, or even just because there was a lot of backlash against public health at times, and it could be, it could be frustrating work for some people. And so the recruitment there and being able to match and compete salary wise with the private sector is always a challenge in any government role. And so being able to recruit and then retain too, again, going back to being able to offer some of the salary and perks that the private sector does would be an ideal. But and I want to say we have done, I think, a good job in the last couple of years as a state in that regard, and that our agency has prioritized. Our agency director's, approach is people first. And so our budget ask from the legislature the last couple of years has been for money for critical positions, for salaries. And, the General Assembly and the governor, I'm very appreciative to them, have given us funding for that. And so we are making strides in terms of recruitment and retention in that regard.
Terrific. Well, you've got a bit of a bully pulpit there, as they say, as Director of Public Health. What is one thing now? It's a new year. People may be making some resolutions, whatever. What is one thing that the average South Carolinian can do right now to improve their health? A quick example, as an emergency and critical care nurse and a paramedic myself, one thing I wish people would do is not hesitate when they have signs or symptoms of a stroke. We see so many people who just try to sleep it off and then have horrible outcomes. What comes to mind is one thing we can do to improve our health?
I think along those lines is not minimizing any of the of any health condition. Mm-hmm. And so that means really being proactive about things like your blood pressure, your weight, your blood sugar, meaning diabetes. And it means, to your point, not hesitating if you have signs of a stroke. I think another big thing that I would promote for all South Carolinians and all people really worldwide is, in the last few days, we've had a football player on the professional level who has had a cardiac arrest on the field. And I think that is a very good reminder that we need to all know CPR.
Yes.
Everybody, not just medical people. And for those that aren't aware, they're listening to the podcast, there no longer is mouth-to-mouth involved in bystander CPR. So you do not have to put your lips on anyone else's. It is chest compressions only. But it truly can save lives. And so, again, not only having that skill, but being willing to use it if you're somewhere where it's needed.
Oh, that's terrific. Well, as we wind down here, what is the best way for people to find out more about the department, the website or email or anything like that?
Absolutely. So our website is definitely the best. It is SCDHEC, SCDHEC.gov, G-O-V. And it has different sections, all on there. It also includes all of the information about our environmental colleagues, our environmental affairs colleagues, and the regulatory healthcare quality side of the agency. But it also has contact information for all of our health departments and offices.
Terrific. Dr. Traxler, thank you so much for joining us and providing this overview for us. I know I'm enlightened. I'm sure our listeners are as well. So wish you a happy new year. And again, thank you for joining us.
Thank you for having me, and happy 2023.
Absolutely. And folks, remember now, this podcast is being offered as a video podcast as well. So you can check out the video aspect of this on your favorite streaming device. And also love to hear from you, whether it be questions or maybe potential topics for upcoming episodes that we have. You can reach out to us at listen@healthlinkspodcast.com. That's listen@healthlinkspodcast.com. So again, I'm DJ Thatcher, wishing you a happy new year, and we'll see you in the next episode of HealthLinks Podcast.